let's do work from home, because I'm curious your perspective on this. You've worked in consulting. You've worked in a hospital setting. I try to explain this to my consulting friends. There's something about healthcare where people being in the same room, people being in the same building has I don't know, a significant amount of value. And I'm not sure I know a lot of health systems are talking going hybrid. I've even talked to some health systems that are like, look, we're remote now and we're never coming back. But I don't think that would have flown at St. Joe's. I think we would have brought people back at least 3/4 of the time, and maybe we would have gone to a Friday virtual day kind of thing. But because there was so much value in the culture in bringing people together and those kinds of things, where do you think this is? What are you hearing, and where do you think this is going to go?
Great question. And I like what you bring up. That the last part, when I read that article, I'm like, yeah, a lot of questions there, and those some to me were a little, I don't know, uncomfortable. But he gets to the last part, and he was talking about culture, in which you mentioned, and I think that's a very important component of the team that you work with. Obviously, when you're in the hospital, you're in the trenches, you're in the ED, you have a certain culture. You're always with these people and you're fighting the good fight, and you get to know people very well. As opposed to, again, working from home. So my experience from working from home, I'll give you my latest experience is, so when I started with Worldwide Technology, I was hired remotely. Okay. I have my boss, I have never met except through like how we're communicating. On my team, one of our other chief healthcare advisors, she's a close friend of mine I've known for years. So that's okay. So I have a connection with her, but literally everyone else at Worldwide Technology, which is close to 8,000 folks, I don't know. So how do we build? And then our team, our healthcare team is made up of 4 folks and 4 clinicians. And yeah, with the exception of one, I don't know the 3/4 of them, except for how we're interacting. But not to say that we do connect on different levels, because we're at that healthcare clinical relationship. We have stories, right? We can kibitz on those stories, and we connect that way. However, looking at others and I think it depends on the person too. I know I'm rambling on a little bit because I'm thinking, yeah, I'm okay with it. I would love to be with my colleagues and see them more often for sure. But I get a lot of work done like in this environment. Whereas when I'm sitting on the hospital, more on the administrative side of the hospital, you get a lot of interruptions. At least I did.
Yeah.
And a lot of distractions and things like that. And the next thing you know, it's 5 o'clock, 5:30, and you're still behind. It's like, oh boy. So it depends, Bill. I think there's that give and take. And now I'll just add this, and I read this story. I think at the end of the day, when I finished that story, I'm like, it depends on the person's job in some ways. The cultural thing is important. I'm with you 100% on that. But at the end of the day, you get hired for a position. Now, does that position require you to be there? So obviously, if you're a clinician in the ED or anywhere in the hospital, yeah, you probably need to be there, right? Except if you're doing remote surgeries, you can if you have the technology, you can do it at your house. So as opposed to maybe one of the IT folks, they don't have to be there necessarily. They could be monitoring the infrastructure from somewhere else and be taking care of problems somewhere else. So I think it depends.